First, I'd like you to tell us your name and where you're from.
My name is John R. Cumis. I'm from West Deptford Township in New Jersey.
Well, John, and you're a patient here at the CCNJ.
Yeah.
Okay.
Yeah.
You use medical marijuana. Why do you use it, and how do you use it?
Well, first of all, I have a pancreatic cancer, and the pain is what it's mostly for, because it helps immensely with my pain. I go and get my chemo, and then after a little while that wears off, I would get pains in my stomach. I would take an Oxycontin, whatever it is, pills, and they would constipate me and everything else. And I asked my doctor about the medical marijuana, and he got me on it. He got me with the forms and everything else to fill out, so I can apply for the medical marijuana. And when I do smoke it, when I get the pains go away. I don't have to take any pain pills, which I like very much. I don't want to take pain pills. But it's helping me awful lot with the pain, because I couldn't take the pain right here in my stomach, and my tumor has shrunk almost 50%.
What would you tell people who see this video, who are people of New Jersey? What would you say about medical marijuana?
I would say anybody that needs it should be on it. It should not be held back on getting it, instead of having to take pain pills, which are very bad for you to begin with. They're addictive and everything else. And the marijuana doesn't hurt. It hasn't hurt me at all. I think anybody that really needs it, suffering with pains and stuff, should be able to get the marijuana easy enough, legally, but easy enough to get it to help them with their pain.
First, please introduce yourself.
My name's Tracy Goldman. I generally go by Tracy McHugh Goldman, and I'm 35 years old. I'm a spina bifida patient. I have lipomyelonmeningocele, which is a very rare form of spina bifida. Some reason I ended up with one of the best cases they've ever seen, although not without its difficulties. I've had 40 surgeries, and I'm looking at possibly at least 2 more in the near future. So this has been a great alternative for me, because I'm also a mother and a 4-year-old, and I want to be part of his life. I don't want to be all pilled out and not be able to be part of his life. I want to be active. He's about ready to get into sports, and that for me, to be able to go and even if I can't run after him yet, just for me to be able to be there and be comfortable through whatever it is he's for. It's more running around than anything else. But it's great, and it's great that I can be part of it, and that's what I needed. Before, I couldn't do that.
What do you use medical marijuana for?
It's actually, I use it primarily for my muscle pain and for help me sleep at night, help me move in the morning, and to help me eat, keep a level of my weight up. I was able to transition off of a lot of heavy narcotics strictly onto the medical marijuana, which has helped me immensely, because it's helped me not only in the sense of to feel better, but it's helped me get away from a lot of the negatives from all of the other medications. And I realized that it made me feel better. And I was one of those patients that had always had a great relationship with my doctors. And I said, hey, I tried this, and it really made me feel a lot better than everything else that I'm on. I'm never going to be pain-free. That's never going to happen. But the drugs weren't helping me either. So this was a good alternative for me to be able to function and to get off all that junk. The American Indians, I've used it for years as everything from, they make lotions out of it that help heal wounds to bruises to everything. If it's something that's been used in this country for longer than we've been around, why would it be something that's so bad now if it's used in the correct way under the correct circumstances?
I'm William Gaskell, and I'm from Central Burlington County. I use medical marijuana to alleviate the pain that I have as a result of neuropathy. Neuropathy is pain from your knees down to your toes and also in your hands. It's numbness and pain. And it's doing a good job right now. For me, it does relieve the pain. And it will do that for a good period of the day. With walking every day and smoking as little as I do, because you don't need a lot of this, it doesn't affect my health. I don't feel. I don't feel it's that much of a drug, because it doesn't give you any of the side effects that a drug would, like gabapentin or Cymbalta or Lyrica. I've tried 2 out of 3 of them, and they did make me ill, and I didn't want to do any more. I won't take oxycodone, because that's habit forming, along with Percocet. This is the only thing left. That's the only thing left that they had for me. It's great here. I mean, I call the people here and identify myself, and they're excellent. They're beyond excellent. In fact, in the short time it takes to do that. And I think that everyone should know. Everybody in the state of New Jersey should know that. I mean, I served in the military. I've owned a business for 25 years on a major interstate here. I've been through college, business school, and now I'm a trader with the New York Stock Exchange. So I'm pretty well versed on how things work, and this program here is the best. I think it's one of the best that I've seen.
I was having seizures. I was having seizures from an unknown source. I've had a lot of brain hits to the brain from playing contact sports and playing football. The NFL is a brutal sport. The collisions are, equivalent to getting hit by a car, if you will. 30 miles an hour, 20 miles an hour, just sitting there while the car hits you. But I was having seizures. No medications were working. So what happened was someone referenced the M word, cannabis. So what I did was I tried it. And since the day I started using cannabis, I haven't had a seizure. If you went up and down my body, I need about 7 or 8 major surgeries. I'm going to need shoulder replacements, hip replacements. So there's a whole pain aspect that goes with everyday living that I have to go through. So, you call it a side effect, if you will. I'm not getting the seizures anymore, but it's also helping with the chronic pain that I have, where I'm not feeling the joint that's dislodged, the sternoclavicular joint, which connects your chest bone to your clavicle or your shoulder blade here. So that's completely dislodged here. And if I don't sleep on it right, I get extraordinary pain But when I use the product, the pain's gone. And on top of it, another side effect, if you will, and I hate even to use the word side effect, because these are things that are working. I wish I could prove it to you. I'm not talking about recreation. I'm talking about helping epilepsy. We're talking about companies that are out there like Compassionate Care, understanding that this plant helps people medically. This product helps. This product absolutely helps me with managing the pain every day. And the seizures are gone. Less chance for suicide.
First, tell us your name, your full name.
Full name, my name is Sharon Jennings. I found out that I had glaucoma about, 30 years ago, more. And they said that smoking marijuana helped from you going blind. If you smoke marijuana, you wouldn't go blind. I lost a third of my vision and had 4 surgeries from the glaucoma over the years. So I've been following the process all the way through. And when they opened this facility, I had followed the process and then applied. And I'm here now. I only live about a half an hour from here.
Oh, okay.
So it was perfect. The location's perfect from where I live.
But how did you find a doctor to identify medical marijuana and write the prescription?
There's a list online. I checked out that list, and then actually somebody that had come in as a patient here had suggested a doctor, and I went to see them.
And he is trained in prescribing medical marijuana?
Yes. The patients that we have coming in, you can actually see the difference in them from the first time they come in. A lot of our patients, you can see they're not in as much pain, or they've had seizures. They're reporting that the seizures have went from, 100 in a short period of time to maybe 1 every couple of months. They seem happier. It's amazing the stories you hear in here and how much it helps people. And they're so appreciative. They're almost in tears sometimes because they're so relieved by their symptoms after being part of the program.
Okay. Thank you.
You're welcome.
My name is Jacqueline Angadi, and I'm a nurse practitioner. And my son is 9 years old and suffers from epilepsy, and he is now a medical marijuana patient. Well, like any medication, you always consider the risks and the benefits, and I would never come to a decision like this lightly, like all the medications. But over the span of the last 7 years, he's tried 12 to 14 different medications, none of which controlled his seizures, and some of them had horrible side effects. So we were running out of options, and we heard about the successes that some people were having in controlling seizures with medical marijuana. So we felt that it was reasonable to pursue it for him. We've seen dramatic improvement since he started.
In what way and how?
His seizures have reduced enormously to where they were maybe 10 a day to now maybe 1. Some days, a couple days he had none. And also he is much more alert, much more focused. His teacher at school called me on Friday. Sorry, this is going to make me cry. Just to tell me how well he did, that he was reading and writing and sent home his homework. And it was, dramatically improved in that short time. So his school knows that he started the medication, so they're sort of just giving me feedback as well. But when she saw what he was able to do, she felt she needed to let me know that it was dramatically improved from her perspective as well. So.
You're a nurse practitioner.
Mm-hmm.
Obviously, you know a little bit more than the average parent about medical treatments.
Mm-hmm.
How do you see the medical marijuana and this procedure in particular as a professional?
I feel great about it if it helps my son and other people who are suffering. I feel great because by nature I feel I'm a healer. That's what I do, and I feel like if I can help my son first and foremost, but help others as well, then that's why I drove 2 hours to get here this morning. I would say that depending on what their condition is, that this could be a viable option. That they shouldn't be afraid of it, that there shouldn't be a stigma about it, that I feel it's safer than many of the prescription medications that we give every day, that we prescribe. I mean, I see patients every day coming in with withdrawal from benzodiazepines and opiates that are legally prescribed by physicians, and people aren't afraid to take those. And this I feel is much less dangerous as far as its addictive properties and its potential benefits that I would, depending on their condition, I think people should consider it.
I am Bill Thomas, and I am the CEO of the Compassionate Care Foundation, which is an alternative treatment center located in Egg Harbor Township, New Jersey. If you call having a debilitating disease earning it, they have to have one of the 9 diseases that are described within the Compassionate Use Act. And those diseases basically center around 2 different areas. One is a neurological problem, and the other is pain or somebody going through cancer treatment. So you'll find people who have MS, ALS, Crohn's disease, anything that has to do with spasticity will be somebody who is eligible for the program. People going through chemotherapy, people in hospice, people who are going to die within the next 12 months also qualify. Well, your doctor has to register with the state on their website. The state has a very robust website for managing this program. So the doctor has to then register on the site. They can then register their patients who qualify with one of those diseases. So the doctor certifies that the patient has one of the qualifying diseases and then gives the patient a code.
And when they come down here to this facility or any other facility, what's the process they go through?
Well, first we will have them call to make an appointment, or if they're new, we'll actually outreach to them and offer them an appointment. We schedule that appointment for them. The day before they get here, we'll call them to confirm that they're coming and answer any of their questions they may have. We are not allowed to take credit cards. By federal law, we cannot take a credit card, so we have to let them know to bring cash or a debit card that they could use. We also take checks. The regulations are really have been established to make sure that only people who are qualified get the product. So that they make sure that the patients are qualified. They also make sure that nothing leaves this facility that doesn't go to a patient. So we have 7 levels of security here. The reality is that the state has regulated us like a vice rather than a medicine. Well, when they wrote the state regulations, they said that they're going to have lozenges and lotions. And we are actually going to start producing those later this year. We're going to extract the medicine from the plant and make them into what people would see as pharmaceutical type products.
Well, Bill, you mentioned earlier, what are the 9 factors that will enable people to...
The categories of illness? Well, there are people, one of the famous ones is glaucoma. So people who have eye pressure, we're getting good response from people now that their pressure in their eyes are going down by using the product. People with Crohn's, which is a spastic colon. Spasticity is one of the things. Spasticity is when your nerves contract your muscles. And that contraction of the muscles often creates pain in people, especially people with MS or muscular dystrophy. So any condition where you have a neurological problem that's causing pain, this will relieve it, or seizures, this will relieve it. So it's really, the categories. There's 70,000 people every year in New Jersey who get cancer and go through chemotherapy, radiation therapy. And what happens when people have cancer is they lose weight. They lose their appetite. They'll lose 20 to 30% of their body weight. They'll just stop eating, and because they're nauseous, and they can't eat when you're nauseous. So it takes away the nausea, and it restores your appetite. People who are in hospice, who have intractable pain, this would help them if they are, have already been into hospice. Any type of illness where you have loss of appetite. ALS is another one, a neurological disease, or AIDS, or people are HIV, and people going through wasting syndrome because of AIDS. This would help them restore their appetite. So there's a whole variety of diseases that this covers. We're getting tremendous response from people with Crohn's because it relieves their symptoms. And if you have Crohn's, you want to get rid of those symptoms so you can lead a normal life. And mothers reporting to us that their children are going free of seizures who have epilepsy. So that's one of our real focuses, is helping children. Well, I think the people of New Jersey have been very enlightened and have really changed their minds about this in the 3 years that I've been involved in it. We've had tremendous support by the people here. We've been supported by Stockton University, has been very supportive. We're actually going to be teaching a course this year at Stockton in medical marijuana as one of the general studies courses. We've given speeches all over the area and have had tremendous response. So my final words are that marijuana people are finding out that it's not what they think. It is not what you expect. And it is helping, our 600 patients are being helped every month by having this facility here.
And that's, another big thing for the veterans that are coming back, is that it's helping them deal with PTSD, to my husband has TBI, to just everything. And that's another thing, that if we want to take care of our veterans, we need to take a few steps back and see how it was done back in the World War II days when they came back.
Well, have you testified before the various committees in the state?
Not yet, but it's something that I'd absolutely love to do. It's something that I feel is a calling for me, because while I do have spina bifida, it doesn't have me. And although I am physically disabled, there's nothing mentally wrong with me. And while my body may not be in the best shape, my voice is the best thing that I have. And if I can use that to help other patients, any other patients, whether they had spina bifida, epilepsy, cerebral palsy, traumatic brain disorder, post-traumatic stress disorder, whatever it is, cancer, any of the ways that it can help glaucoma, diabetes, asthma, if my voice can help change, then that's what I want to do.